histamine. Children with pneumonia, they may respond to antibiotics. So it is very important that you find out the cause of cough and start a remedy for this. And you must be very careful in prescribing cough syrups which contains multiple ingredients like a first generation cephalosporin, phenylephrine, and so on. Dextromethorphan with antihistamines are a combination given. So you must be very careful in selecting a cough remedy for our children. So with these words, we will start our webinar, and I have great pleasure to invite my close friend, Dr. Devaraj Raichu, for his talk on legal aspects of cough and cough syrup. Dr. Raichur needs no introduction. He is a very close friend of mine. When I was the national president in 2011, he was in the executive board. He was in the executive board of Indian Academy of Pediatrics. He is a professor of pediatrics. Previously, he was in KIMS Hubli, and now he has shifted to another medical college, and he is running his own hospital. And he is a very good academician and a legal expert. With these words, I have great pleasure to invite Dr. Devaraj Raichu for his talk on legal aspect of cough syrups. Raichu, please.
Yeah. Good evening, everyone. Sukumaran sir, that was a great introduction by you about me, and it is my actually I'm fortunate to be with you all people, Chug sir, Rawat sir, Modi sir, and my own friend Subramanya. Apart from Sukumaran sir, who was the president when I was executive body member in the Central IAP. So it is a pleasurable day for me. So today we are going to deal with the legal aspects of what has happened during the last, few months in India regarding cough syrup usage under the age of 4 years and 2 years. So what are the guidelines that we need to be following in the days to come? Because the practice that was happening so far was it was a kind, and I don't say that actually medical recommendations have changed, but our practice is going to change. So let's start with our slide sharing. I'm just going to share the slides. Are the slides visible, sir?
No, sir. No, Raichu. Oh, now it is there.
It's coming?
Yes.
Yeah. So I have kept the topic's name as cough, cold syrups and recent legal issues, because that's what most of us are interested in. And I will not be covering in my speech regarding the etiology, pathogenesis, pathology, and all those things. So, and treatment, including the management, except for some management part, I may be touching, which is related to legal issues. So what are the objectives for today's discussion? First thing is I'm going to summarize the legal regulatory framework for cough cold medicines, then explain recent government orders, state advisories, and WHO alerts, and let's have some practical legally safe treatment approach for children less than 4 years old, and then we can discuss also, because there may be many confusing aspects, especially when it comes to the law. To exactly delineate what is right needs some discussion. So we can have it at the end. So background of the disease is, I'm using this cough as well as cold together because most of the times they are of viral origin, and in less than 4 years, mostly it is viral origin, and therefore they are self-limiting. And if there are danger signs like respiratory distress, poor feeding, and high fever, then we may consider complications that are happening with viral disease, and they may need some extra measures, special measures, and maybe emergency measures also. So I'm not going in depth about that part. So why legal attention today? So that we need to address. And this was a report from WHO. You can see that it is dated 5th October 2022. So if we just highlight what is important in that, it is that 4 products which were manufactured in Haryana in India were found to have DEG, that is ethylene glycol and diethylene glycol, as contaminant or maybe solvents, and they were found in Gambia, and the supplier was from India. And those people have not responded to WHO's queries when this was published in 2022. So in 2023, 1 year, almost about 6 months later, I should say, will not read the whole thing, but just will focus on the things which are underlined. So what WHO has said is that over-the-counter cough syrups for children have been found to have confirmed or suspected to have contamination with high levels of DEG, that is diethylene glycol and ethylene glycols, and more than 300 fatalities. That is by 2023, January 2023. More than 300 fatalities in 3 countries happened, and most of these were young children under the age of 5 years. And the toxic chemicals which were used in industrial solvents and anti-freezing agents, which can be fatal even when taken in small amounts, were present in them, and they should never be found in medicines. This is what WHO said. And before this 2023, already 3 alerts the WHO had published in 22 and 23. So on 5th of October 2025, the government of India produced a notification urging the even states to use rational use of cough syrups, because we saw that in early October there were reports of many children dying in Madhya Pradesh, and the origin was a factory in drugs factory in Tamil Nadu. So there was a emergency meeting, and the Ministry of Health and Family Welfare produced a notification for the states to take actions. In union territories, obviously, the central government would take the actions. So, government of Karnataka on the next day, that is 6th of October, so they brought out an advisory regarding rational use of cough syrups in children, and it made it mandatory to be followed. And we'll see later. I will just discuss about what Karnataka government said. And similarly, many other state government. I'm taking Karnataka as just one example because I'm from Karnataka. So I'm taking this as an example. But many other state governments also have taken similar measures. And on 13th of October, that is yesterday, WHO warned of contaminated cough syrups of India. And it specifically mentioned specific batches of cold drip from Srishan Pharmaceutical, Respi Fresh TR from Rednex Pharmaceuticals, and Relife from Shape Pharma. So this is yesterday, WHO has warned. So why legal caution now? That is, as we discussed before, and Sukumaran sir also said, and all of you know, that recently there were deaths linked to contaminated cough syrups. Diethylene glycol and ethylene glycol were found. And most importantly, there is heightened regulatory action by the state, that is central government as well as state government. And there is heightened media attention also. So this makes rational practice of pediatric medicine more important than ever, because there is media attention. Parents are also asking now questions whether the cough syrup that we have prescribed is really necessary. So our practice has to now modify with becoming more and more rational with all this questioning coming from media and parents, of course, as well as from the state. So recent international and national alerts, as I had already mentioned, WHO medical products alerts and warnings in 2023 and October 25, recently, that is 13th yesterday. So WHO has noted these things, and FDA and international agencies monitoring contaminated syrups also are happening. So Indian government, that is Indian government and Ministry of Health and Family Welfare also have taken actions with high level meetings chaired by Union Health Secretary. We just saw that report, their notifications, which happened on 5th of October 2025. And there have been advisories on rational use of cough syrups and revised Schedule M emphasis. The Schedule M emphasis comes under Drugs and Cosmetics Act. So central regulator and legal powers. CDSCO enforces Drugs and Cosmetics Act in Act 1940 and the rules under that act, and it can prohibit manufacture sale of drugs, and it has got provisions for seizure, recall and penalties under the act. Why I'm mentioning about this is I'm going to talk something about storage of medicine, procuring of medicines also, because some of us may be practicing or maybe dispensing medicines, and we may be having our own pharmacies in the hospitals, and this discussion would help. So state actions, I'm taking Karnataka as an example. Karnataka has produced an advisory that do not prescribe or dispense cough and cold syrups to children less than 2 years, and ban specific brands, which WHO has already mentioned there, as well as between 2 and 4 years, the government has told that it has to be documented why we are prescribing, and it is only when it is indicated, it has to be prescribed by the doctor, not as over-the-counter medicine. And the state level vigilance, sample testing and drug recalls have also been emphasized, and similar actions have been taken by other states also in India. Legal instruments to note, the Drugs and Cosmetic Act, it deals with how drugs are distributed and dispensed. It is specifically misbranded, adulterated and spurious drugs. Regarding that, it has got provisions. And revised, the Schedule M has been revised, and manufacturer compliance and quality of assurance have been made compulsory. Prescribing rules and pharmacist responsibilities, prescription only sale obligations, correct labeling and warnings are required now. Pharmacists must follow drugs controller directions, and the sale of banned products is an offense. Now, today, if anybody procures cold reef and drugs like that, pharmacists, the ones which have been known to have contamination, then it will be an offense actually. So age-based practical rule. I'm not going to go in depth about this management part, because Dr. Subramania is going to do that. Just I'm mentioning what is legally cautious approach in this. Less than 2 years old, avoid cough cold medicines as far as possible, and use non-pharmaceutical methods of treating, and you follow the state and central advisories. In children 2 to 4 years, avoid routine use of these cough cold medicines. Use only when clearly indicated. Age weight dosing should be accurately mentioned, and use for shortest duration. Coming to initial assessment, again, I'm not going to in depth about this, just I'm just touching this subject and then going forward. So history, danger signs, vitals, hydration, feeding and respiratory examination we need to look at, and investigations whenever indicated has to be done. So what are the non-pharmacological measures? Again, it is not in-depth discussion. It is just for the completion of my speech. So hydration, nasal suctioning, saline, humidification, antipyretics as needed, parental counseling. These are important. Parental counseling, I emphasize a little bit more. So documented advice and written instructions. This here the medical legal part comes. So documented advice and written instructions strengthen the medical legal position. So whatever we discuss with the parents, as far as possible, document it, even in OPDs. Pharmacological measures. What is legally safer? Paracetamol, ibuprofen for fever and comfort. Again, here ibuprofen is a second choice, not the first choice. Paracetamol is the first choice because it has got least side effects. Ibuprofen, though, is more effective to control fever for a longer duration. It is not the first choice because of side effects, which are little bit more than paracetamol. OTC cough syrups for less than 4 years, and if used in 2 to 4 years, it requires a strict justification and documentation, as I said before. So medical legal documentation is a must have. Clinical findings, reason for any medicine given, informed consent, parental counseling. Here informed consent is specifically applicable to educated people. Even in India, for most of the medical practices, we don't take informed consent. We take only real and valid consent. There is a slight difference. In real and valid consent, the doctor will be in the driver's seat. He will decide how much to reveal and to the parents. Whereas in informed consent, everything related to the disease and the procedures and choices has to be revealed, which is practiced in USA, but it is not practiced in India as of now, except when certain laws, like say artificial reproductive technology laws, or maybe examination under POXO Act, or maybe Surrogacy Act, they specifically mention that informed consent has to be taken. And when legislation is mentioning informed consent has to be taken, one has to take that. But for other aspects of medical practice, real and valid consent is what is acceptable in India, even by Supreme Court. Whereas the National Medical Commission has had brought out certain regulations now, which have been kept in abeyance. It was active for about 2-3 weeks only, in August 2023, 22 or 23, I think. Only 2-3 weeks it was active. There, they had mentioned specifically that informed consent is a must. But later, those regulations have been kept in abeyance. So, what was Supreme Court's ruling before that? That is, real and valid consent is applicable to all medical practices except when the legislation specifically requires informed consent. So coming to the batch brand documentation if administering syrups in clinic. So if we are dispensing the syrups and in clinic, we'll have to document all these things. So reporting and pharmacovigilance. Report adverse events immediately to state drugs controller or the controlling authority. Then maintain drug sample and batch records if adverse events are suspected. So implications for our practice and procurement of drugs and what should be the clinical policies. Remove brands from clinical stock. So we need to check if we are having a pharmacy in the clinic only. Remove those banned brands and check supplier certificates and batch traceability. Establish local standard operating procedures. Manage cough clinic workflow and escalation triggers. So communication with families and public, it has become more important than ever. So clear, calm explanation about self-limiting nature of the disease, danger signs, and when to return. And provide printed guidance and dosing charts. This is preferable. Preferably, we can provide these things. so that it will help the patient management also, as well as it will protect you medico-legally. Discourage home remedies that can harm. So, in summary, legally safe checklist for pediatricians are: do not give cough cold syrups to less than 2 years old children. Avoid routine cough syrups in 2 to 4 years old children. Use only if indicated, and that too with documentation. Follow the state's advisories. State, when I say state, it is central as well as state government. And report the adverse events. So keep records, brand, batch, etc. about the drugs that we are dispensing. So with this, my short talk is over. Now I'm handing over to Dr. Subramanya for detailed discussion about the cough, medical aspects of cough and cold. Thank you.
Thank you, Dr. Devraj Raichur, for an excellent presentation in a short time on legality of giving cough syrups and syrups. And now we will have the discussion later. We will go for the second talk by Dr. Subramanya. Subramanya is Subbu for me, and he's an outstanding teacher, academicians, and a learned scientist. And he had been with me in the Central IAP as executive board member, and he was the vice president of Indian Academy of Pediatrics from subzone, and he was the professor of pediatrics and the medical superintendent in Vaidehi Hospital, Bangalore, and at present he is working as superintendent in the Kuppam, I think it is Andhra Pradesh. And with great pleasure and privilege, I invite Dr. Subbu for his talk on scientific aspects of cough and cough syrup. Dr. Subbu, please.
First of all, let me thank Dr. Sukumaran sir for blessing us with these words. I think both myself and Raichur are blushed, and both of us, sir, we give you hundreds of pranams for a senior teacher like you. While on the same side, I would also thank somebody of the stature like Dr. Chug, Dr. Sharma, very, very senior members who would otherwise would be the speakers and accepting us as the speakers and trying to moderate. And Raichur and myself, we decided that this is such a complex topic that we will speak and the seniors will answer to most of the questions. And Dr. Sharmaji, Dr. Chug, and Dr. Sukumaran, I think that's the reason why you are here is just to browse our slides, but then there are a lot of things that we as a team of pulmonology, we should answer to the public, and that was the reason. Dr. Rawat and Dr. Modi have been with me throughout my life, and I think contemporary friends, thank you so much for accepting the invitation. And let me have a disclosure as far as this particular webinar is concerned. The timing of this particular webinar may appear like it is the timing related to probable anticipated elections of Indian Academy of Pediatrics, where I am the probably a contestant for post of honorary Secretary General. But let me use this disclaimer. This was not meant at all for any of those conflicts of interest. But the problem was that too many messages came in WhatsApp, too many explanations, so much flooding of inquiries that it required some of us to answer on a platform. Please understand the need. In fact, it is very, very difficult for me on the one side to send a promotional message and on the other side to answer all the questions that have been coming. It is taking more time for me to answer the questions, and therefore we thought that on a single platform, let us share. For all of you, you are free to vote for anyone. But let me tell you on this disclaimer that we are true academicians, and we have been the true academicians throughout our career. Kindly excuse me, I have to tell these couple of lines as a disclaimer so that the timing should not be mistaken. It's fantastic. Now I'll start sharing the screen. There are two issues here, the cough and cough syrup. Let's not link the two. If if we understand more and more about cough syrup, we will try to find excuses to write a cough syrup. If I know more about amoxicillin, I would give an amoxicillin. If if there is a fear of prescribing a newer antibiotic, I may not even write. I'm just giving you an example. So therefore, we are not going to tell you what are the components of 110 medicines in a cough mixture, each and its role, because you would be feeling, yeah, I think there was more secretions in that particular patient, let me give that. And you will never know other 99 that accompanies that one that you would be tempted to prescribe. Am I getting it right? I think on the chat box, be on the hotline, and as and when you are going to have the doubts, type then and there itself. My colleagues will answer, we will all take the answer together. And I will be very brief, I'll go very fast because I need to cover nearly 30 slides in a matter of around 25 to 30 minutes. Please bear with me for the speed. You can interrupt me whenever you want. We were the makers of cough module. This thought came to me when I was secretary of the respiratory chapter. Then why can't we have a module for cough? I think Dr. Chuk sir will acknowledge we had a huge discussion. And we had a cough module, we had a pneumonia module, we had module for each and everything from nose to alveoli. And this was extensively covered during the tenure. And the reason was that it was a need of every pediatrician. I'll make it full screen. Yeah. Now, would just go ahead and focus on real signs of the cough. Now, the problem is not the cough. Problem is the pressure from the cough. Who are pressurized? The working parents, young child, and the kind of distress it would otherwise produce. Sleepless nights, because the coughs are more in the night times than the day times. And a modern mother doesn't want to leave the bottle feeding. There are instances where, I think I would find a day in which they will use ChatGPT or a smartphone to stop the cough. Because to feed now, the mothers are using smartphones. Abhi either Gana dekho, khao. And then a day may come, abhi khasi kam karo, ye mobile dekho. And I'm sorry for these words. And that's the kind of the pressure which the parents have. They will be jumping from syrups to syrups, from doctors to doctor. When not either because of the syrup or because of the disease, if there is a problem, they'll blame it on the doctors. No matter what happens after surgery, you will relate each and everything in the post-surgical period to the surgery itself. Do you all agree? We have all gone through this in our life. Once a surgeon puts the knife, then he has to answer to each and everything that is going to happen in that patient. Similar is the sentiment. We have never understood the public in the right spirit and in the right way that we really need to understand. Therefore, according to me, cough today is not a symptom, but a problem. And all of us agree on this. It's not just a symptom of a disease, it's a problem for a pediatrician. And the moment you decide that it is a problem, there should be a solution to the problem. Today, all of you have joined only to look at the solution to the problem. And then we will give you the solution. Mind you, if we can't give the solution to a problem, it means that we have never understood the problem. I think Raichuri would agree with me. I'm just take the conversation because I want to keep it live. You'll agree, if you have not understood a problem, you can't give a solution. If you find a solution, that means you have understood a problem. Therefore, my dear friends, if you have not solved a cough in the clinic, it is just because we have not understood the cough. It is not because you are searching for a better cough syrup. There is no better cough syrup. There is no ideal cough syrup either, which I and you would wish to have. But the problem is that we should understand the cough. Let's do a small exercise. And this will be the food for all the panelists over here. 2-year-old Vinod comes with troublesome cough on 5th to 7th day following an upper respiratory tract infection. The fever has subsided. And please now in the chat box, prescribe. Don't cheat now. Don't go back to the hot news. Don't go to the press release. Just recollect your yesterday's prescription or today morning's prescription. Be honest and type. I'll just give you 30 seconds of time. Please type. Whatever you feel like, you please feel free. Don't worry about it. Warm water, reassurance, cetirizine, ascaril, antihistamine, Maxtra, honey, breathe less, humidification, honey, glycerol SOS, saline nasal drops, Eracort MDI, honey, ginger, Alex JR, lukewarm water, levosalbutamol, reassurance, tulsi, honey. And I think I don't need to read further. I'm very happy that the crowd is very honest. Sir, I think all of us should clap for the crowd. The way they have responded is something that speaks purity of the minds of the pediatrician. They've just written what they are going to write. And I think that we should acknowledge. And don't you think so when everybody is typing? There is a huge problem in ourselves and we blame the public and the government. We do right. And when the problem comes on to us, then we start looking at the excuses or we will start having the problem. My problem is different. Do you need a cough syrup? And I wanted to just today you log in and look at, there is an interesting article in the net that is available on cough score. Even I was new to this. Please, this how reliable it is, I don't know. There's something called cough score, which will tell you how troublesome it was, how many times you coughed. See, it is just measuring the cough. For a mother, 2 coughs may be more. For some other mother, 20 coughs may be less. You got my point, per day. And there is something objectivity that is required because parents always hype the presentation. Mothers are anxious. That's why we can never ever estimate the cough and need for the cough syrup. We fix the prescriptions irrespective of whether the cough is 2 times a day, 20 times a day, troublesome, not troublesome, required, not required. I think, are you getting my point? Suppose if somebody, there was an interesting note, probably Dr. Sukumar would recollect that ADEX module, which we were all part of it when we discussed that antihistamines have around 33% efficacy in reducing rhinorrhea and symptoms. So that means to say your cough may be reduced by 33% if it is due to rhinorrhea, and that too in the early part of cold and congestion. I'm just coming to one aspect of antihistamine. In that case, what can happen is that, you know, if you are coughing 8 times, you will cough 6 times in a day. Please tell me as a mother, if I am the mother, if I am given a choice to cough 8 times or 6 times, 8 times without an antihistamine, 6 times per day with an antihistamine. So always there is some debate from the pharma, from the science, from the people who manufacture, people who debate in courts, people who debates in science, telling that there is some effect, there is some demulsion effect, there is some secretory effect, you know, there is some mucolytic effect. How much is the effect? How cost effective? How scientific? Does it make any relevance and difference in our clinical practice? I think we have never ever answered this very objectively. Now, if you start classifying your outpatient pediatric practice coughs into tolerable, not tolerable, troublesome patients, or real troublesome cough, I think you would reduce 90% of your prescription. Can I just recollect pertussis cough? Really, it is troublesome cough. Even though it comes 3 or 4 times in a day, but it just troubles everyone. So my point is that why indulge and get into trouble with these? I'm very happy with all of you, but let me give an answer to you as well as to what I would do. It all depends on the phenotype of pediatrician, whether you are a pure academician or a pure private practitioner. More a practitioner you are in your hearts, then you would think that let something cover it up. And one of the ingredient may come to my rescue and help me out. And that's why the pharma went on adding one after another. I can show you a cough syrup which contains 2 milligram of salbutamol, cetirizine, promethazine, and a muscarinic agent, plus ambroxol, plus something, whatever you want, you name it, you have it. It can cover up for each and everything. It is broader than the broader spectrum antibiotic that you can think of. That is just a galaxy. It is Vishwarupa Darshana of Sri Krishna that you would see when you see the cough syrups. I would just ask you to do an exercise. Please type all the syrups and start looking at the composition of each one of them. Then you would realize actually whether you would require all of them, whether you would require one of them, whether you require two of them. The moment you start asking questions, you will have the answer. Now, my whole issue is, if you are a true academician, you may ask me a question and I would just pose it to a couple of academicians who are here, Dr. Sukumar and Dr. Chug. Sir, what will you do if they come to your clinic? They have paid for nearly 2,000 rupees in Delhi. They come to Dr. Chug sir's consultation chamber. He has paid, the mother has paid 2,000. I'm sorry, sir. I'm not disclosing your consultation, but I'm just imagining. Probably a person of your stature would receive around 1,000 to 2,000 rupees consultation. In Delhi, a mother comes and says, sir, I have a cough. What Chug sir should give? A blank paper? They will just ask for refund of money. I mean, that's the plight. Which Dr. Chug sir, that smile speaks volumes for me. I'm just pulling you, sir. I'm sorry. You are a teacher of teachers. But Dr. Sukumaran sir is also a busy practitioner. He would, apart from being an academician, then again he will be in trouble when he has to charge but not give anything. Can I give an A4 size blank paper and then say, I have given you wonderful advice? They will say, thank you for the advice. Once or twice, even the patients, when I have told them don't take any cough syrup, they have thrown the prescription paper on my face in Bangalore. I'm not joking. It has happened to me. And let's also understand the reality. Then you would ask me what you would do. The more academician you are, more brainy you are, you don't listen to your heart, then there is a problem. The more private practitioner you are, you would listen to your heart more, so much so that you will have cardiomegaly and microcephaly. You will never listen to your brain, then there is a problem. I think you need a mind to heart balance and decide when you will give and you will not give. Select to give. Select not to give in most of the instances. Then what happens is your chances of getting the benefit, cost effectiveness, everything goes up. I'll just give an example which I have never understood. There are parental history of allergy and there is an URTI, cold and cough. You would just give montelukast and levocetirizine. Try to understand. A cost per day for a mother is 20 rupees per day for nothing. While levocetirizine, only if you prescribe, if you want levocetirizine, then it would just cost you 2 or 3 rupees per day. It doesn't make any sense for us. You give a bottle, 100 ml bottle of which they don't use anything. There is a huge problems that we are facing. Please, for heaven's sake, evaluate the outcome of your prescription. Don't say I prescribe because they're pressurized. What is going to be the outcome of our prescription? I think this needs some introspection and you need a perfect mind to heart balance. What I meant by this is, those of you who have cardiomegaly, please bring your heart size to the normal. Prescribe monotherapy. Maybe, for example, a salbutamol may be good enough. May not, a normal nasal drops may be enough for a nose block. And those of you who are academicians, don't say I won't prescribe. Prescribe something, but in the bracket write down do not take. And you know that A4 size paper is filled, but yet you have given an advice, don't take it. That if you are desperate, come back to me second time and then take. Then they may not come at all. So there is some kind of buffer that you can do. You can find out your own ways of evading the pressure from the parents, but it doesn't end there. You can't be jury, you can't be autocratic, you can't be like a Hitler telling that I will give, I will not give. Please explain your inability to handle the cough. It is not your inability, it is the inability of the science to handle the cough. Message number 1, maximum number of irrational prescriptions. And you are all asking the question, why can't government stop it? The government runs on this budget. Government's budget runs on this. Please understand. There's a huge volume of money that is involved. It is a big industry for any one of us. Handful of pediatricians, even from the Indian Academy of Pediatrics, IMA, whatever platform you take to fight. Do you all recollect how breastfeeding fight versus the industrial product of milk makers? We had to fight. I don't want to take the names because we don't. Let's forget as much as possible. It is not easy a battle. When I asked Annie Chang, who is authority in the world on cough syrups, on cough, she told in one of the congress and also in one of the webinars organized by IAP Respiratory Chapter, she told Dr. Subramania, it is nice to have a battle, but this is a long battle. Like you going to a court, the person who won the case is also lost in life. The person who lost is anyway lost. It's like that. Please understand, this battle is not as easy as any one of us would just, take it out on a social media. You really need to be behind each one of them for years together on the battle. It requires a lot of regulations at the government level and so on, so forth, with Dr. Raichur would probably answer in question answer syrup. But what can I do? You need to counsel.
Dr. Subramanian, can I sorry?
Yeah,
You have a
interrupt,
good
sir.
message here, and you have many more. So if you move faster, maybe
Then
people
point
will
taken.
get something
Point taken.
in about
Yeah,
20, 30
I'll
minutes
just go
that we have
faster.
with us.
This is only
please.
this message number 1 was little slow because of the current context. The chronic coughs and all I'll browse. Now the message number 2 is this cough is not a problem or a disease, but it is a reflex. And it is a protective reflex from the brain stem, and therefore we can't suppress it, and that is not possible. Where are the cough syrups? They are in the airways to protect it. And which part of the airways you have cough syrups? More closer to the glottis, more is the risk of food to airway congestion, common passage, and there are more cough syrups, and therefore there is more cough when glottis is involved. There is less cough when alveoli is involved, less cough when nose is involved. Are you getting the point? The more away from the central airways you move, less is the cough, because central airways need a lot of protection. This is the cough is a product of stimulation of receptors. And we localize the cough. More the cough, more benign is the disease. But for some emergencies like foreign body, groups, etc., let's keep them by the side, which you can anyway recognize as a syndrome. But as far as infections are concerned, which are the commonest causes of cough, more viral a disease, more the cough. More bacterial a disease, less the cough. More proximal the disease, more cough. More distal the disease, it more breathlessness. This is how you can localize, and lesser the cough does not mean better the outcome. Cough is hallmark of airway disease. It is a protective reflex. Please beg for the mothers that I am not going to take away your protection, which is required. In fact, something goes in, the child or the airway needs to throw it out. And probably there is a secondary outcome, like it becomes troublesome when the protection is more. Post-infectious cough is the most troublesome cough for most of us. I would just ask you a question. Suppose by mistake you drink hot water, coffee or tea by mistake. You would just have burnt your mouth, and then you will have burning sensation. You will put ice, you will take ice cream, you will take honey, do so many things, but nothing calms down because there is a post-burn injury to the epithelium which causes that. Or you eat a chili and then you drink water, you do, no matter whatever you do, there is always an irritation that is producing. And post-infectious cough is an irritative cough following in infection, be it viral URTI, be it bronchiolitis, be it pneumonia. You can have post-infectious cough. The problem of a post-infectious cough is it is in the recovery phase. Please tell them the phase of illness. They will be very happy. If you try to chase the cough, then you are wrong. Chase the timeline of the disease and tell them that this is benign because yesterday you coughed 32 times. Today you are coughing 16 times. Probably 2-3 days later you will cough only 4 or 5 times. Please explain the downhill nature of the disease. That will solve the problem. But it is not that as easy as we speak because it is challenging. Suppose if the cough becomes progressive, then they will blame telling you that if I come in the first week or second week, now it turned out to be TB, now it turned out to be this, that, etc. So please tell them that in case if there is no downward trend, if you find any other symptom other than the cough, like fever, weight loss, etc., please come back. So only cough. And if it is post-infectious, you can always give assurance. Dilemma for a pediatrician and the problems for other pediatricians when they go is somebody would give antibiotics, somebody would give macrolides, somebody would do CBC investigations, chest X-ray, etc. And in an X-ray, you will see some artifacts, something else. Then they will start do other tests of TB, this, that, etc. They will all get into trouble. I will tell you, it's always problems caused by the practitioners that we face in this 2 weeks to 3 weeks. This is very, very important for us. And the challenges continue when it comes to 2 weeks, NTEP comes in. But remember, it is not for cough alone that NTEP pitches in. A complex of cough, fever, and weight loss. So only cough, post-infectious, associated symptoms, think of a disease. For example, TB, age-related signs you need to think like foreign body aspirations. TB, I will exclude from today's discussion because it's a different disease by itself. Cough is not a problem, TB is a problem. If you reach to 3 to 4 weeks, you will have 1 or 2 coughs just to say that I'm present. Don't worry if it is self-limiting. Recurrent cough is a problem, and recurrent cough is a problem because we treat the cough but not the cause of recurrence. It could be nursery school where cough syrups don't work, aspiration syndromes, we don't take history, a congenital heart disease, sometimes murmur may be missed in a busy chest. I have missed a VSD murmur when there is gora 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 in the chest, and all of us remember, and variants of asthma and so on and so forth. There is one URTI overlapping another URTI, giving rise to chronic cough syndrome. Sometimes you would feel that what is this problem going on for such a long, but when you take the history properly, you would see that there is multiple episodes. Do not prescribe cough syrups. Again, I'm coming to the point on 1st of September and on 30th of September, if there is cough, mother says that whole of September there is cough. So are you getting my point? This is the history that you need to take and be smart. Chronic cough, I will just suppress it for the day because this is a different discussion by itself, but I will just in 2 minutes, I'll browse through. This cough of more than 4 weeks, you need to separate chronic cough from prolonged cough. And whenever there is a subacute or a prolonged cough, most of the time they are benign and you need to make serial examinations than over investigations. Please separate the chronic cough from prolonged cough. You can see various types of videos. I don't want to show the videos today. This was a cough which was prescribed a cough syrup. This doesn't require a cough syrup. I have prescribed this cough syrup. Don't worry, nobody else. It's my video. I had a cough syrup for this baby. This child. This is a, can you make out that lower respiratory cough? Yes. Look at this. I'm browsing very fast. Please look at this video. Identify this is an asthmatic cough. There is a cough mixed with wheeze and the child itches while it is coughing. I'm telling you beforehand. So this was a case of interesting case of cough, which I would share you. Probably in the next month again, this cough I solved on what I would say WhatsApp only, and this was an interesting case, and therefore I will not disclose the diagnosis, but suffice here to tell you that this child had, this was the cough, multiple pediatricians, multiple pulmonologists, multiple investigations. This was second, after treatment, he is much better. 3 coughs I have shown you. First, when he was symptomatic, there is a story of 6 months in which I have treated this patient, and probably next time I'll share with you. The reason is today's context doesn't tell you about this story, therefore I'm skipping for the sake of completion, right? And there could be much more problems than the cough. What I always do is ask the patients to take the videos. So please take the videos. You understand what is their problem. Please ask them to take the videos, and that will do. This is again, I'm showing you various types of cough, because it's always possible to make a diagnosis provided you have the videos. And I'll cut
Dr.
it short.
Subramania, sorry
And
to
I'm
interrupt
closing.
you.
Yeah.
No. The audio is not available. Only videos are seen. Audios are
Okay,
not.
then fine. Then I will go. I'll skip fast. Okay. The nature of the cough can be known from the videos which the parents can bring. I will come to the last part and close it. The prolonged cough can be non-specific or specific. If it is specific, you will ask the history. You will have some pointers. Evaluate the characteristics, host, and the environment. Never forget the environment, smoking. And always have wait and watch policy. If it is benign, you should always ask this history, whether the cough is dry or wet, and it is prolonged. And then accordingly make some diagnosis, which I'm just browsing for all of you. You need an approach for the chronic cough, which I'm just cutting it short only for want of discussion. Let me tell you the summary. Cough is a protective reflex, not a disease, not a symptom for you to treat with drugs. You need counseling, and let me tell you how to counsel.
Yeah.
I'm just coming to the end of the discussion. The counseling is most important. And how do you counsel? Please explain them the benign nature of the disease. Please explain them that the dog which barks will never bite, and the disease is benign, but the symptoms are more, but you need not worry. Please tell them that the parenchyma is not involved, only small airways are involved. They will be very happy. You avoid irrational prescriptions which you are taking as a substitute for counseling, which is important. I think that's the problem, because we don't have time for counseling. How to do counseling, sir? You can have your talk of 10 or 15 minutes on cough and a roll of cough syrups, and make a short video and give it to the receptionist. You need not have to talk to each patient for 10 minutes. Let them see the video and come back to you and ask you, sir, I have gone through the video, now I am fine and comfortable. There is absolutely no problem. Beware of red flags, treat the disease and be happy, and be a calm pediatricians, and do not panic. We have a lot of questions, and I think I finished in time. Now it is 9:57. We can have around 15-20 minutes of discussion, and whosoever wants to ask the doubts, you restrict yourself to acute and subacute or prolonged cough, and let's suppress for a while our discussions on chronic cough, because the need of the today is a legal and scientific battle which we can have on the cough. I think I will stop sharing and would invite all the experts to have a wonderful discussion, and all of us will feel free to answer and take any questions that you would find relevant. Let me, in summary, tell you 1 or 2 lines. Please be honest, be answerable to yourself, and never take the things for granted, because we always think that someone else has the problem I don't have the problem. And when the problem comes to you, you will not have the time. So this is very, very important. And when it comes to you, you will say, oh my God, I never thought that this would happen to me. Why me after all? Then only horoscope can help you, nobody else. Please remember this point. Never ever think that you are always safe just because nobody is complaining, just because nobody is questioning, just because the government will have 101 ways of escaping. But they were asking, we are just lawmakers. Hum to unpad hai. You have done 10 years of medical experience, and what about you? Do we have an answer? My last, because this was the question that was asked to me in the chat earlier to this webinar, are the Ayurvedic cough syrups to be prescribed by medical practitioners? My point is that you are not, and therefore no, and most of them act by irritation of the stomach. You take a ginger or you take chili, whatever mixture, whatever you take, will stimulate the stomach vagus, and therefore, as a protective reflex, it will induce the cough and you would have some clearance. There have been some questions on tulsi, this, that, etc. For some reason, it is difficult for any one of us to take. Probably matured minds would answer. Probably I'm out of answer as far as these questions are concerned, but definitely would take debate of science of the cough syrups. Last line, please understand the science of the cough and reduce your need of the prescriptions. That's the line. And then I will close and hand it over to Dr. Sukumaran, Dr. Modi, Dr. Rawat, Chug, and Dr. Sharmaji.
Dr. Subbu, thank you very much for an excellent talk as usual. And now I invite our lead discussant, Dr. Chug, for his comments. Dr. Chug, please.
First point is that the context why we are so much interested in cough today is that event. But what we are discussing is science. We are discussing our role, not the role of the politician or the manufacturer or something. That's a separate issue, a very sad issue, something that we feel very strongly about. But let's restrain ourselves to what we thought should be the discussion today. So now when we talk about cough, Dr. Raichu very nicely started, less than 2 years, 2 to 4 years and later. Our issue is this young age. Most of the cough syrups that are there made by standard companies may be prescribed in older children when you have a reason for it. You have to have a good reason, which is documented in your prescription. Why are you prescribing a cough syrup? Choose the cough syrup which is kind of has a combination, if at all there is a combination, which is scientifically correct and legally correct. Otherwise, stay away from those cough syrups. Now we have so many cough suppressants and dilators, and many questions have come. When do we use a bronchodilator, whether oral bronchodilator can be used or not, and as a cough syrup? So, as starting point was, we have to be practical also. Suppose a child comes to me with a lot of cough. I suspect that maybe something like a salbutamol will work. This is the first time ever that patient is being exposed to. He is not a chronic cougher, he is not a recurrent cougher. At this time, when he has come to you from the cough sound and your examination, we can find out possibly it is. There is no rhonchi of that side, but possibly yes. What should we do? Should we give them a prescription of a levosalbutamol or salbutamol? Probably yes. But which form? You tell them to start using an inhaler for one episode? Nobody is going to accept it. You ask them to start using a nebulizer? Not scientifically correct. You tell them to buy a syrup and give it? We don't know. There are many who think the syrups don't work. So we have our own problems. And those are not problems of an individual. Those are the problems of science. That's where we are with our science. It's not a perfect science that we are dealing with. So our discussion has to be which particular cough syrup or a cough suppressant or a cough remedy will work and how do we measure it. I just want to take show you just one slide if I'm allowed to share it.
Sir, you can share the screen, no? You are the co-host.
Yes, I'll be able to share. Just give me a minute, I'll share it.
No issue, sir. No issue. I was just looking into technical issues.
Can you see it? No, not yet.
Yes, sir.
Yes, sir. Scene, make it full screen, sir.
Full screen, slideshow.
Okay. What is this? No. Where has my Zoom gone?
Slideshow.
Okay, your screen sharing, but it is not coming. That's
Sir, it's
yes, it
okay.
is
No
coming.
Okay,
problem.
it's okay.
It's okay, sir.
Okay.
No
You
problem.
can see. This is good.
Okay. Now you look at this. This is taken from a review article, which says RCT proven efficacy of antitussives by 3 different cough measurement methods. First, focus on these 3 methods. First is subjective clinical symptoms. Second is objective cough recording. And third is cough challenge. Let me explain to you what does this mean. Subjective cough clinical symptoms are that you bring a syrup in the market, conduct a survey, give it to hundreds of children, ask the parents, did this help? And they say, yes, it is yes. This is how it all started. Many, many, many years back, before science was so robust as it is today, say 50 years back. Benadryl, for example, became a very common prescription in US and all, where it still exists as a cough syrup. And there is no, and if you look at the bottom of the slide here, diphenhydramine has no objective evidence at all, even not even subjective evidence that it actually works. So that's how the first type of cough syrups came in. Then the other 2 are the proper methods by which you should be checking and seeing. That means science should be evaluating. The last method that here is the third one, cough challenge. What it means. If I think that dextromethorphan works, I give dextromethorphan to say 50 children and not to the next 50 children one by one, whatever. Of course, there'll be double blinding and all that. And now a cough stimulant is given, something which will precipitate cough. And there are scientifically proven things, for example, something which comes out of capsicum, something which comes out of chili. Those are the things which are scientifically accepted as cough challenges. Now you give cough challenge of, say, X amount of and dextromethorphan given or not given is what is being tested. Then that dose goes on increasing till almost everybody is coughing. Now you know that some of them were given dextromethorphan, some were given placebo. Later on, you analyze your data and come to know whether when you gave a challenge, to what dose those who were given placebo did not cough and those who were given dextromethorphan did not cough, and work out the difference. And you know scientifically whether a cough syrup or a cough remedy, for example, cough suppressant is working or not. The middle method, which is their objective cough recording. This is the best method today. Cough challenge is also accepted by FDA USA, but cough recording is the best and the gold standard today. What it does is that there's a device which will detect a cough of a particular child which is coming up at a particular frequency. That means if suppose the child's father coughs, it will not record it. It is so specific. It is first it kind of tuned to that, and then overnight, whole 24 hours, 48 hours, that is kept on where the child is. And then you can make out how much actually the child was coughing before you gave the suppose a dose of dextromethorphan. 6, 8, 10 hours later, the effect waned off. You gave the second dose, and again the cough recording shows you that it came down, and it happens again and again and again. Then you have an FDA-approved method of demonstrating what cough is. As you would realize, these 2 methods are both not for us as practitioners, but they are the ways by which FDA gives approval today. So that's one background. Now let us look at these drugs. Codeine is supposed to be a very strong cough suppressant. And look at this. There is no subjective clinical symptom. There is no objective cough recording. There is no cough challenge positive either. So there is no clinical convincing evidence of efficacy. Let's take dextromethorphan. Subjective 1+, objective recording 1+, cough challenge 2+. It is well characterized in objective studies, and this is the only cough suppressant, which in USA is a OTC drug. That means you can buy it without any prescription. Now let's go to levopropizine. The way to remember the name is levopropizine. That means those three segments ending with O and then pizine. So levotropizine is something which there is subjective symptoms, probably yes, but other two again not much. And you know that this is the cough challenge, yes. So this is one which is supposed to be peripherally acting. In that sense, safe. And as Dr. Rawat has put it in the chat box, more than 2 years it is approved, and dose is generally 1 milligram per kilo. Ambroxol, subjective only, nothing objective. Menthol, there is a cough challenge, it probably works, but it is probably because of the demulcent effect or that kind of effect, vapor effect, but not really as a cough suppressant. And diphenhydramine, I told you, there is no evidence at all. So if we look at something like this and we follow this from there, for example, dextromethorphan seems to be the best of the lot. Similarly, morphine is supposed to be the strongest cough suppressant. And codeine is supposed to be even stronger than that. Here you see that there is no effect. So that is what I wanted to bring to your notice. I'll stop sharing and I've made my point. Rest of the points can be covered by others.
Thank you.
Sir,
Dr.
just to
Chuk.
add,
For
to
next time.
Dr. Chuk sir, Sukumaran sir, sorry to interrupt. General anesthesia is the best to suppress the cough.
Yeah. See, no, Chuk, I want to make a comment. As you said, the best cough suppressant is dextromethorphan that is given in US. But here the problem is dextromethorphan is combined with other antihistamines. Such combination is available. That combination should not be given. You must give only dextromethorphan alone in correct dose judiciously. It will be a very good cough suppressant. Now I invite Dr. B.S. Sharma. Sharma is here.
Yes, sir.
Dr. B.S. Sharma.
Yes, sir.
Yes, please have your comments.
Sir, my sincere regards to the galaxy of panelists, including my teachers, Dr. Sukumaran, Dr. Chuk, and dear friends. In the lecture, Dr. Subramanya has rightly justified why he is being called as a very, very popular teacher. Even our residents are fond of attending his classes. It has been evidenced in this lecture also. It is a very good combination of the knowledge of the physiology of cough, the clinical aspects, and the most important one is the counseling techniques. But for my comments, I just want to convey to the audience the way which I feel the cough should be handled. As he has rightly said that cough and the cough syrups are two different things. Cough is not a disease. It is just a symptom. So look for what is causing cough. Then as rightly said, divide them in benign or it needs to be treated. Then cough syrup is not a medication. There's a variety of combinations. So the clinician should first ask himself what is causing cough. Is it really a benign productive reflex or it has become a problem to the parents? Whether it needs to be addressed or just to be counseled. If it needs to be counseled, you are confident about that you have seen red flag signs and you are sure that the cough is not causing any problem to the child, but the cause of cough, whether it is a post-nasal drip, or it is a post-viral cough, or the child has an atopic predisposition where the viral infection has brought out the hyperreactivity, or there is some serious underlying disease, the clinician should first address these issues and ask himself what I'm really treating. Cough is just a symptom. So what disease I'm treating, and in the physiology, what is really causing cough? Only then he can address. The second part is when you are prescribing any medication which is called as cough syrup, please look into the ingredients. Most of them are irrational combinations where if you are going to titrate the dose of one medication, the other is either under dosing or overdosing. So it's extremely important to prescribe only the required component of the drug if it is available. Otherwise, we should restrain from prescribing a cocktail of the medications, because most of these medications are containing sympathomimetic agents, pseudoephedrine or phenylpropylamine, in combination with various antihistaminics. They all cause serious side effects of cardiac arrhythmia, cardiac toxicity, or CNS excitement, or even sometimes seizures. So be aware of the efficacy as well as the therapeutic margin, if they really need it. So you ask yourself why I am prescribing this particular type of medication. If you want to write an antihistaminic, is it really needed? Is it going to affect the outcome? If I'm writing a cough suppressant, why it is needed? If the cough is benign and counseling can done, probably that is the best answer, because most of the coughs are self-limiting. But if the cough has become distressing to the parents, address that concern equally. As Dr. Subramanian has rightly said, cough, when it becomes a problem, should be addressed by both the pharmacology interventions, non-pharmacology interventions, and the counseling. In pharmacology intervention, you have to be very choosy. You define the ingredient which is really going to help you in that particular physiological sequence, that this particular part is causing cough, I should handle that. Cough syrups, as Dr. Chu has already been in his elaboration, that most of these cough syrups, in most of these viral coughs, have proven not better than a placebo. So for that matter, you can be sure that whether you give the cough syrup or not, the outcome is going to be same. So this needs to be explained to the parents. So only two questions: what is causing cough? And what is causing cough means the basic disease behind that and the component of that, whether it is a postural drip or hyperactivity. Only try to address that. There's nothing like cough syrup. It is a combination of the drugs. So be specific what you really want to prescribe, but it is really effective. At the same time, it has to be extremely safe and the required doses. So the only word is be selective in your prescription. Prescribe
Dr.
only the
Sama.
drug which you think is really going to be therapeutic efficacious, and at the time it is extremely safe for the child. Thank you so much.
Thank you, Dr. Sharma, for excellent comments. Now we invite our Raut, Sanjeev Singh Raut, for his comments. Raut, please. Sanjeev Singh Raut.
Thank you all. Now I'll just make my comment in very short time. Everybody's asking, what do you mean by cough syrup? What do you mean by cold syrup? So the very simple answer is that, like for example, antibiotic syrup, a syrup which contains an antibiotic. So cough syrup is any liquid preparation which is used to treat cough. Now the problem is that we have been voicing hoarse since past many years. Please use this medication rationally, but it has been falling on deaf ears. We've been seeing babies as young as 1 day, 2 day, 10 days old with cough being prescribed Coldac drops and Triminic drops innumerable time by senior pediatrician. In my city, I've seen they were prescribing Coldac drops and Triminic drops to a baby who is 1 month old. We have been crying hoarse not to use that, but it fall on the deaf ear. So the reason of discussing this particular thing is that babies who have died, they have not died because of chlorpheniramine maleate or paracetamol or because of dexamethasone. They have died because of contaminant. What we are telling is that please use this medication rationally. Like for example, would you prescribe an antibiotic mixture which contains tamoxifenolane, cephalexin, metronidazole, and 4,5? Will you do it? You will not do it. If you want to treat tonsillitis, you will give tamoxifenolane. Same way, we are just trying to request you. First principle: use only single component medication. Whatever you want to do, it should never contain more than one ingredient. So you will be compelled to think that what I'm going to treat. As Dr. Chuk, Dr. Subramaniam, Dr. Sharma told you, first think what is the underlying cause of cough and why should I prescribe a medication. If it is an allergic cough, use antihistamine. If it is because of bronchoconstriction, there is lot of wheeze, you can prescribe salbutamol. If it is causing severe distressing cough to a child about 2 years, child is vomiting, cannot sleep, and you've ruled out infections, it is just a chronic or it is just a prolonged post-viral cough, you are justified using a peripheral cough suppressant, levodopa, that too in proper doses, shortest possible time. So there are a lot of caveats, and if you just put your mind behind why I'm prescribing the medication, what is the correct medication, is it a single product for formulation, is my dose right? I don't think you will ever be wrong. I don't agree with this thing that parents they force and all these things are all wrong. If you just talk to the parent rationally, your child is having a self-limiting problem, and by giving medication, it can harm your child. They will understand. They will not pressure you. So, to end, please find the reason of cough. Give them a single ingredient prescription in proper doses for the shortest period of time. Thank you.
Okay, thank you. I want to again highlight the point regarding antihistamines. As Dr. Raut has said, no antihistamines in children less than 6 months. In 6 months to 2 years, if you want to give an antihistamine, it should be preferred a second generation. And first generation antihistamines are even given for newborns. Combination of chlorpheniramine maleate and phenylephrine is even prescribed for newborn as drops. No antihistamines in less than 6 months. And from 6 months to 2 years, prefer to have a first generation antihistamine, and all cough syrups, you preferably select a cough syrup or a cough remedy which contains only a single ingredient. Now I request Dr. Modi, the Secretary of IAPNRC, for his comments. Dr. Modi.
Thank you, sir. Good evening, everyone. And deeply grateful for the enlightening presentation from Dr. Raichur sir and Dr. N.K. Subramanian, and lots of words of wisdom coming our way from Chuk sir, B.S. Sharma sir, and Rawat sir. I'll just make few points before this August audience. Now, dear friends, from my point of view, why we write cough syrups? For me, it's usually because of time constraint. We are all intellectuals. We have been through all the grind. We know all the science. Even after that, we keep writing cough syrup. Why? Because there is a lot of time constraint. Second is parental pressure and their expectations. Then there is a inertia of motion. We have been writing it for months and years. That's why we are writing. And then friends, they are prescribing. That's why we keep prescribing cough syrups. So before going on to prescribe anything, these 4 things. Cough syrup. Number 2, for cough syrup, we usually listen to cough. We hear enumerated by N.K. Subramanian. Have to have a look. How is the child? Is the child smiling? Is the child active? Is the child feeding well? Is he not sick? So these things should guide us whether we should be prescribing a cough syrup or not. We all know that most of the time it is acute, and around 90% of the time the cough is self-limiting. So before going on to write, we should actually look to the child, then hear the cough. Then to actually prescribe something for the cough, it has already been discussed. It should be chronic. It should be recurrent. It may be distressing, or there should be cardiorespiratory compromise. So for treatment as well as for investigations also, I will just add this point also. So these 4 things should decide whether we are going to treat the cough, whether we are going for some investigation or not. Then many questions have come in the chat box that, sir, this is the situation, what should we give? This is the age, what we should write. So we should write this or that. My dear friends, so whenever there is a question that what should you give, my answer is, for all the situations, please give time. Please give some time to the child and the parent. And as we have, what should you do in a clinical situation? So before doing any good, please do no harm. So that should be our priority, do no harm. We always should remember that cough is good, cough is protective, cough is mostly self-limiting. So we should refrain ourselves from writing any cough syrup.
Thank you,
Thank
Dr.
you so much.
Modi, for the excellent comments. Subramaniam, we have got
I would just
time for taking
no,
up questions.
I want to just come back with a couple of comments because I was rushing through and there are a lot of remarks from them that there should not be time restrictions. Sir, if you permit me, I will tell you one or two points about the politics of the pharma and how does that play with us as far as the current scenario is concerned.
Yeah.
The problem with many pharma, I discussed one of the leading pharma in the conference around 3 or 4 years back also. They were telling that, sir, we are sponsoring, number one. Number two, we are manufacturing because you are encouraging. If you stop writing, it's okay. 99 doctors prescribe, therefore I'll manufacture. Now the hepatitis B vaccine is not available because no private practitioner is giving hepatitis B vaccine. Please understand, the moment we stop prescribing, it will start becoming non-available. Number one. Number two, the point which I want to tell you, there was a question on monotherapy and how to give monotherapy. The safe drugs are actually, if you have lower respiratory disease, a plain salbutamol or a levosalbutamol, which is proven little safer than many other probable contemporary medicines that are available. Whether salbutamol works or not is a debatable issue. It may not work in bronchiolitis, but when it works, and probably it is safe. What happened? I'm just sharing you the politics of the pharma. Salbutamol is brought under drug control. And when it is bought under drug control, the 25 rupees bottle of 100 ml came for 12 rupees. What the company did, it added bromhexine and made it 24 rupees. Then it added ambroxol and made it 45 rupees. Then it added from 60 ml to 100 ml and made it 60 rupees. Are you understanding my point? Now the point is that suppose tomorrow we will all act and bring ambroxol plus salbutamol into drug control, then they will add another component to escape. And the problem is with the doctors only, not with the manufacturers. Now, let me tell you, if we are not stopping prescribing the drugs, we are prescribing infantile drops of decongestants. We are prescribing antihistamine decongestant nasal drops to infants, newborns, 6 months babies as well, not systemic, even local, without even understanding. And therefore, they are, where there is a need, there is a sale. They are selling because we are prescribing. And initially, they need you to sell. Later on, they sell themselves. That is because initially they need your prescription, and many patients Xerox the prescription or take the prescriptions on phone. My dear friends, now artificial intelligence has come. What if your prescription, somebody loads it on ChatGPT and asks tomorrow, is it correct? Then you are in real trouble. Please let us not repair or put speed breakers after an accident happens. You play safe. Or I would say, I don't say become totally rational. I would say, is it possible to become less irrational? I think we will be even less irrational is halfway through and we are done. And this is very, very important. 3 or 4 lines, Dr. Sukumaran sir, thank you for permitting me because I was rushing through. For all of the viewers, let me tell you, the cough module is available in the National Respiratory chapter. Wonderful module of 4 to 6 hours. You can ask the office bearers or mail to me after the current elections are over. We will run the module for you. Please learn the complete science. It's not possible in 30 or 40 minutes to detail you each and everything. Each one of these is being discussed in detail as to how we should handle. Please participate in large numbers. 4 or 5 years back, you were in thousands for those webinars. Again, it will come back to you. It doesn't require any spending, just sitting online for 3 or 4 hours. Dr. Sukumaran, back to you.
Okay, thank you very much, Subbu, for your comments. We are running short of time. It has took 1 hour 30 minutes time. And I want to conclude by saying that cough syrup, as even though Subbu said it's a problem, I again say cough is a symptom. And when a child is presenting the symptom, you must try to find out the cause of the symptom and treat accordingly. And children less than 6 months, it is better to avoid all antitussives, no antitussives and cough syrups below 6 months. And in Kerala also, cough syrups are not given for children less than 2 years. And above 4 years, you may give